the philosophy that I have is that every part of the procedure, and from the initial contact even that the patient has on the phone, you have to treat each patient as an individual, and you have to do every component of what you do for that patient well. So you've got to be good on the phone at giving them information. You've got to have good information on the internet or in your brochures. You've got to educate the patient well. When they come for a consultation, they often spend an hour with us. Now, you know, traditionally when you do a consultation with someone and they come into your office, you spend 5 or 10 minutes with them, send them off for some tests, and they see them another 5 or 10 minutes. Different with this. You've got to educate them, spend the time, make sure their expectations meet what you can give them. And then throughout the surgery, every bit of the surgery is important. So what the assistants are doing is as important as what I'm doing as a surgeon. And because of that, I do a lot of what the assistants do. So I look at the strips under the microscope, I dissect strips under the microscope, I place grafts, checking throughout the whole thing that the quality control is there. Send patients out of the clinic looking, you know, nice, blow drying their hair, making sure their scalp's not messy. All of those things are very important. And also thinking about how the patient feels, putting yourself in the patient's shoes and saying, well, that patient is scared coming in. Well, what can I do to alleviate his anxiety? Can I do something while he's sitting there in the chair to make the whole process more pleasant? You know, every single component of the operation and the aftercare. It's looking at everything in total and not just saying, well, I'm just looking at the surgery bit, I'm just looking at taking out the donor bit, and that's my bit, you know, leave the rest. It's all critical.